If you're turning 65 and you're getting ready to come into Medicare, you're probably hearing about Medicare supplement plans. So how do you know which one to choose or how do they work? I'm going to explain it all for you right now. It's not so hard, so stay tuned.
Medicare on video, Medicare on video.
So let's talk about Medicare supplements. And when you're turning 65 and you're coming into Medicare, you've got a lot to learn. So you've probably figured that out by now, that you need to figure everything out because you have to make some choices when you come into Medicare. And I'm going to try and make it as easy as possible for you to understand exactly what Medicare supplements are and how they work. I'm Keith Armbrecht. I'm founder of Medicare on Video, and I help people across the country make the right Medicare choices. And I can certainly help you as well. And there's no cost to use my service. So whatever insurance company we end up choosing, they pay me a little to be your service agent now and in the future. So it makes a lot of sense to utilize anything you can that'll help you make the right decisions. So one thing I would ask now is, if you do find this video helpful, please subscribe to my YouTube channel. It's a big help to me, and it tells YouTube that it's valuable, so they show it to more people just like you turning 65. So let's talk about Medicare supplements real quick. Pretty easy to understand. So the first thing we need to understand really is, why do we need to have a Medicare supplement? If we have Medicare, why do we need a Medicare supplement? Well, when you come into Medicare, the first thing you do is you have a choice, and it's a big choice. You need to understand this as well, and I have other videos on this, but you're going to either choose to stay on original Medicare, which is Part A and Part B, or you're going to choose to go into a Medicare Advantage plan, which kind of puts things together. Now, the biggest difference between these two, staying on original Medicare gives you much more flexibility and freedom to choose whatever doctor or hospital you want to use now or down the road. And that's anywhere in the country. Medicare Advantage plans are more of an HMO type environment, where they may have a lower cost on the front side in premium. They generally have a higher cost on the out-of-pocket expense, and then you're limited in the doctors and hospitals you can use. You have to use a specific network of doctors and hospitals, and a lot of times you have to get a referral to go from a primary care to a specialist. So that's the biggest difference between staying on original Medicare, A and B, and choosing a Medicare Advantage plan. So if you do stay on original Medicare, A and B, you need to understand kind of how it functions. And it covers quite a bit, but it doesn't cover everything. So that's where a Medicare supplement would come in. If you have original Medicare, Part A and Part B, Part A covers the hospital. So it's the inpatient part of your health care. So if you're ever inpatient in a hospital, it's going to fall under Medicare Part A. Now, the biggest out-of-pocket cost with Part A is the deductible. So you have a deductible on your Part A of $1,420, and that's for year 2020. So we're coming up on that right now. So in 2020, the out-of-pocket deductible for Part A is going to be $1,420. Obviously a big deductible, not something you'd want to be facing if you're going to go into the hospital. So that's a reason you get a supplement, is to cover that deductible. Now, Part B costs are outpatient costs. So everything kind of that happens outside the hospital, where you have doctors, outpatient, whatever it may be, it also has a small deductible. In 2020, it's going to be $197, and then it pays $80/20. And that's great coverage, but the problem with it is the 20 has no stop. So if you have a normal year, not a big deal. If you have a few $100s in medical expenses and you're paying 20%, not a big deal. The problem is if you have a catastrophic year and you have a $100,000 year or $1 million year, then that 20% can elevate very quickly. So that's another reason you want a Medicare supplement, is to cover what Medicare A and B do not. Now, Part B also has what's called excess charges, and that's a little bit of a gray area. I go into some in-depth on it on other videos, but excess charges come down to when you're choosing a Medicare doctor, whether they accept Medicare assignment or whether they just accept Medicare. And if they only accept Medicare, then they have the ability to bill 15% above what Medicare is going to pay them. So that's another reason you might want a supplement, is to cover excess charges. So I have a video on how to pick a supplement. So, it's not quite as black and white as it needs to be, but it's really not that complicated. So you can see here on this chart, and there's some changes now in 2020 where Plan F is no longer going to be available. So you're going to be choosing generally between Plan G, Plan N, or Plan GHD. And if you take a look at the video link above, that'll bring you to my video on the best Medicare supplement. And then I'll also put the link below this video to help you choose. And that's what I do, is I help you find the right choice for where you're located. So if you visit my website, MedicareOnVideo.com, you can put your basic information right there, and we will get you a quote on Medicare supplements wherever you live. We're licensed in 49 states, so we can help just about everybody, and would certainly be happy to do it. And again, if you found this video helpful, please take just a second and subscribe to the channel. That way you'll always have access to my videos when they come out, and it will certainly help me and help YouTube understand that it's something of value that others would like to see. So I hope you found this video helpful, and I hope you have a fantastic day.